The provincial plans are now being made public. The Western Cape also announced today its plan of action to vaccinate its healthcare workers. Some 378 vaccination sites in the Western Cape have been identified. More than 400 medical personnel will administer the jabs. And to tell us more, I'm joined by the Western Cape's Head of Health, Dr. Keith Clutie. Good evening, Dr. Clutie. Thank you very much for joining us. So how exactly is it going to work in the Western Cape? Do you know exactly how many healthcare workers and support staff that you want to inoculate?
Good evening, Sally. Good evening to the viewers. Yes, we know exactly. We have 133,000 people that we want to vaccinate. We know exactly who they are, where they are, and we have a plan in place to be able to vaccinate all of them. How many doses are you getting and when are they coming to you? Okay, so we have the confirmation from the National Department for 3 categories. So we've got the confirmation of the first 2 categories. We're waiting confirmation of the 3rd category. So just to explain the categories. The first category is everybody that's employed by the Western Cape Department of Health. That's the department that I'm the head of. And we have confirmed from National 35,000 doses for all our employees. The second group is all private employees in the Western Cape, all private healthcare workers. And they've also got a confirmation of 58,000 for that group. And then the third group is a combination of people that does not work for the private sector or for us as the provincial government. And that's a combination of community health workers, people that work in the city of Cape Town as healthcare workers, health science students, undertakers, and then a range of other people that work for other departments, but also traditional healers. So all of that adds up to an additional group of people, and we're waiting for confirmation from National on that 3rd figure. Then we will have 3 figures, and then that's the composite picture of knowing exactly how many doses will arrive in the province. All right, so you're expecting absolutely definitely 93,000 doses. When are they coming? Yes. According to our estimations, they will arrive by about Wednesday next week in the province. And we have made plans that it comes to one central point, and from there we distribute it to our sites for vaccination. So we expect our first vaccination to be on Monday, the 15th of February. And how long will it take to vaccinate everyone with the doses that you have? Because of the schedule that we have, and it is in different sites, there are different people in different places. All right, we seem to have lost our audio. I'm just going to try one more time. Dr. Clutie, I think we've just lost audio. I can still see you fine. Let's just try again with the audio. I don't know if you accidentally muted yourself. You're back with us? Oh, yes, I can hear you. Perfect. All right. Sorry about that. Yes, I've got you. I don't know what happened there, but, you know, technology is not always our friend. I wanted to jump in and talk about the cold chain concern. You know, these vaccines have to be transported in refrigerated trucks, I understand, and then, of course, kept cold until they're used. Are you confident that you can do that everywhere they're going? We can be very confident we can do it everywhere, Sally, because our current vaccination program, which we've been doing for many years, has exactly the same requirements, and we do vaccinations as far afield as Beaufort West, as Vredendal, and we maintain the cold chain all the time in the trucks that takes them there. Great. Well, that's good news. Premier Alan Winde last week or so indicated that he's also trying to secure more vaccines for the province over and above what the national government is giving. Are you able to tell us whether that is still part of his plan and if he's had any success? It is very much part of the plan. Just to clarify, the intention was taken to provincial cabinet. There's a formal cabinet resolution that we will have a contingency plan in place. And just to clarify, the contingency plan is when and if required to bring in additional vaccine to support the national program. It's not in competition with the national program, it's to bring additional vaccines in if and when required. There's very clear stipulations, and currently a team from my department and from Treasury are busy looking at the implications for doing it. It's quite complex,
And we will actually have to work out exactly how we're going to do it, but that is the intention in the Western Cape, in support of our colleagues in the National Department.
All right, so you're all geared to start administering your first jabs Monday the 15th. A question we're all seized with, though, is how do we keep corruption out of this vaccine rollout? What's the plan in the Western Cape?
Well, I mean, look, we come off experience from the first and second wave. In terms of how we manage PPE, procurement, supplies. The Auditor General has been here. There's been no evidence of any corruption anywhere in the way that we've managed PPEs in this place. We have a proud history of doing things in the right way in the Western Cape with all the necessary controls. We're pretty confident that all the controls are in place to look at and to counter any corrupt activities.
Thank you very much for joining us this evening. That was the Western Cape's Head of Health, Dr. Keith Cloete.